Good morning, students. Today we will study about the pelvic diaphragm. What I have shown here in this picture is a hammock. Okay. So, the pelvic diaphragm is a gutter shaped thin sheet of muscular partition which is slung like a hammock around the midline pelvic effluence like urethra, vagina, and anal canal and separates the pelvic cavity above from the perineum below. So this pelvic diaphragm is situated between the pelvic cavity above and the perineum below. The components of the pelvic diaphragm are levator ani and coccygeus. These two muscles will be present on each side and two fasciae enclosing the muscles. They are the superior and inferior fascia of the pelvic diaphragm. So this is a pelvic diaphragm which is lying like a hammock. So the cavity above the pelvic diaphragm is a pelvic cavity and below will be the perineum. This levator ani has two parts, an iliococcygeus and pubococcygeus part. So both part arise in continuity from pelvic surface of the body of pubis, tendinous arch or the white line of the pelvic fascia and pelvic surface of the ischial spine. So here you can see this is the ischial spine, this is the white line of the pelvic fascia and from the pelvic surface of the body of the pubis. Okay. So this whole part is the levator ani. Okay, so it is present on each side. Okay. And this is the coccygeus muscle. That is a coccygeus muscle. So this is a female pelvic diaphragm. So here you can see the opening for the urethra, vagina and the anal canal. So this is the pubic symphysis, this is the sacrum. Okay. Here you can see this is a levator ani muscle and it is forming a sling around. This is the rectum, this is the uterus, this is the urinary bladder. So it will be forming a sling around all the structures so that it will be kept in place in the pelvic cavity, so as to prevent the prolapse. Okay, prolapse of each structure. We will come to that later. Now we will talk about each part. Okay, so this levator ani, as we have told, it has an iliococcygeus part and a pubococcygeus part. This iliococcygeus part arises from the posterior half of the white line. We have already seen the white line and also from the ischial spine. So this is a posterior part. Okay, and it is inserted to lower two pieces of the coccyx and into the anococcygeal raphe. So this iliococcygeus arises from the posterior half of the white line. So it is arising from the ischial spine also. So this is the ischial spine and this is the posterior half of the white line, right? So these are the two origins of the iliococcygeus muscle, and it is getting inserted to the this is the anococcygeal raphe, and also to the lower two pieces of the coccyx. Okay, so this is sacrum, and inferior to the sacrum you will see, so here you can see a part of it, like so it will be here. Okay, in that area, lower two pieces of the coccyx. So that is the origin and insertion of the iliococcygeus muscle. This anococcygeal raphe, it is also called as post-anal plate. It is a layered muscular fibrous tissue. Okay, and it extends between the anorectal junction to the tip of the coccyx. So this is the anorectal junction and to the tip of the coccyx. So that is the anococcygeal raphe. Now coming to the pubococcygeus. This pubococcygeus arises from the anterior half of the white line and from the body of pubis, and according to the insertion it can be named as pubococcygeus proper. So this pubococcygeus proper is the most posterior fibers. It will overlap the pelvic surface of the iliococcygeus and are inserted into the anococcygeal raphe and the tip of the coccyx. So here is the pelvic diaphragm in a female. As you can see, this is the iliococcygeus, this is the pubococcygeus. So the pubococcygeus proper are the most posterior fibers. They overlap the pelvic surface of the iliococcygeus, right? And they are inserted to the anococcygeal raphe and the coccyx. So this is the pubococcygeal, this is the anococcygeal raphe and to the coccyx. So that is how the pubococcygeus proper is present. Then there is puborectalis. Puborectalis will wind around the, so we will see it in this picture. See, you can see a part of levator ana is winding around each structure. Okay. So this is the rectum. So you can see the fibers of puborectalis winding around the posterior aspect of the anorectal junction. Okay. So we will see that better in the male pelvis. Okay, yeah. So here you can see this is the posterior most fibers of the pubococcygeus. So this is the opening for the rectum. Okay, so you can see the fibers winding around the rectum, and it is joining with the fibers of this same from the other side. So it will be forming a U-shaped sling. Okay, U-shaped sling. So the importance of the puborectal sling is that it is located below the anococcygeal raphe. Okay, so it is located below the anococcygeal raphe and forms a component of the anorectal ring and maintains the continence of the feces. Okay, then there is puboanalis. These fibers are inserted into the wall of the anal canal between the sphincter ani internus and externus muscles. Then there is pubovesicalis in males and pubovaginalis in females. Okay, so these are the most anterior muscle fibers of the pubococcygeus. So as you know, this is the urethra, this is the vagina. So this anteriormost fibers will pass by the side of the vagina. Okay, the side of the vagina, by the side of the vagina, and forms a sling. Okay, and they are inserted into the perineal body. We'll come to the perineal body later. Okay, so these are the four parts of the pubococcygeus muscle. Pubococcygeus proper, puborectalis, which forms the puborectal sling. Then there is puboanalis, which will get inserted in between the sphincter ani internus and externus. Then there is pubovesicalis in males, or pubovaginalis in females. Now coming to the perineal body. The perineal body is also called as central point of perineum. It is called as gynecological perineum in females. So it is a pyramidal fibromuscular node, and it intervenes between the anal canal and urogenital apparatus. And its apex receives rectovesical fascia and perineal muscles in 3 strata. The deep strata, from the deep strata, it will get attachment from insertion from the levator ani. In the intermediate strata, it gets insertion from the sphincter urethrae and transverse perineae profundus and deep part of the external sphincter. In the superficial strata, it gets insertion from the bulbospongiosus, transverse perineae superficialis, and superficial part of the external sphincter. So here you can see the perineal body. Okay, so you can see the insertion of the above said muscles. Nerve supply of levator ani is by the posterior part of the levator ani is supplied by the fourth sacral nerve, and the anterior part is by second and third sacral nerves via the perineal nerves. Now coming to the coccygeus, or it is also called as ischio-coccygeus. Okay, so it is triangular in shape and is situated behind the levator ani. Most of the posterior fibers of the muscle degenerate to form the sacrospinous ligament. So the apex is at the ischial spine and sacrospinous ligament, and it is inserted by its base into the sides of upper two pieces of the coccyx and last piece of the sacrum. So in this picture, this is the coccygeus or ischio-coccygeus muscle. So as you can see, the apex is at the ischial spine and the sacrospinous ligament. So sacrospinous ligament is basically the degenerated posterior part, posteriormost fibers. Okay, and the base is the base. So it is triangular in shape. The apex is at the ischial spine, and the insertion is to the upper two pieces of the coccyx and the last piece of sacrum. Okay, now coming to the nerve supply. It is supplied by fourth and fifth sacral nerves. Now we will talk about the openings of the pelvic diaphragm. So there is a hiatus. Hiatus means opening. Okay, so hiatus urogenitalis. It is a triangular gap between the anterior fibers of both levator ani muscles. The gap is closed from below by the urogenital diaphragm and transmits the following structures. They are the urethra in males and urethra and vagina in females. So the vagina will be situated behind urethra. Okay. Then there is hiatus rectalis, that is between the perineal body and the anococcygeal raphe. It is a round aperture and it transmits the anorectal junction. Then there is hiatus of Schwalbe. It is an abnormal opening when the levator ani fails to arise from the obturator fascia, and through the gap thus formed between this obturator fascia and tendinous arch of the pelvic fascia, pelvic viscera may herniate into the corresponding ischiorectal fossa. Okay. So, in this picture, this is a picture of the male pelvis. Okay. So, this is a hiatus urogenitalis, and this is a hiatus rectalis. So, this is the picture of ischiorectal fossa. So, here you can see the levator ani muscle. So, this is the levator ani muscle. This is the ischiorectal fossa. Okay. So, if there is any abnormal opening, okay, if the levator ani fails to arise from the obturator fascia. So, this is the obturator fascia. Okay. So, so we already know that a part of levator ani arises from the obturator fascia. So, if there is a gap in that, through that gap, the structures in the pelvic cavity can herniate into the ischiorectal fossa. So, that is the importance of hiatus of Schwalbe. Okay. Okay, so what are the functions of the pelvic diaphragm? Why is it important? You know that it is slung like a hammock, right? So, it supports the pelvic viscera because the pelvic cavity is above this hammock, above this pelvic diaphragm. So, it will support the pelvic viscera and counteracts the downward thrust of the diaphragm during increased intra-abdominal pressure. Okay. And in males, the anterior fibers of the levator ani elevate the prostate. Hence, this anterior fibers of the levator ani can also be called as levator prostate. And in females, the anterior fibers will constrict the vagina and act as a sphincter vaginae. So, it will prevent the downward displacement of uterus through the vaginal canal. The coccygeus muscle pulls the coccyx forward after it is displaced backwards during defecation or parturition. What is parturition? Parturition is a process of giving birth. Okay. Okay. Then during defecation, the puborectal sling will relax and the rectum and anal canal form a straight tube. At the same time, the pubo-anal fibers will elevate the anus. Okay. During parturition, the puborectal sling upon which the fetal head rests, it will allow the forward rotation of the head into the lower part of the birth canal. And in micturition, that is the process of voiding the urine, the pubococcygeae will relax as the intra-abdominal pressure increases and the bladder neck descends. So, this descent will stimulate the contraction of the detrusor muscle of the urinary bladder and thus will help in the voiding of urine. Now, coming to the clinical aspects. So, here you can see the general anatomy. Okay. So, normally this pelvic floor muscle will wrap around the underside of the bladder, uterus and rectum. So, it will keep them in a place and provide stability. So, again there is a fully supported pelvis, and when the pelvic floor is weakened, they tend to fall down. Okay. So, cystocele, as you know, it is a prolapse of the anterior wall of the vagina due to pressure of the urinary bladder. Okay. So, this is how the cystocele will appear when the patient is in the lithotomy position. Whereas in the rectocele, the prolapse of the posterior vaginal wall by the pressure of the rectum will occur. So, you can see that rectocele is falling onto the, or it is impinging on the posterior vaginal wall. Okay. So, there are several degrees for the rectocele also. Okay. Now, coming to the prolapsed uterus. So, basically in the prolapse, the uterus will descend into the vagina. So there are different degrees of prolapse. In the normal, you can see the uterus is placed above, right? So in the first degree, it is starting to descend into the vagina. By the time it is second degree, it will be at the level of the introitus, and by the third degree, it will be outside the introitus, and in precedentia, the whole uterus will be outside the introitus. Okay. So you will be learning about that in further clinics and all. So you just have to know the prolapse of uterus can occur if there is weakening of the pelvic diaphragm. So this is how precedentia looks like. Okay, so the whole uterus has come out of the introitus. Okay. And in parturition, we already told that the fetal head will be resting on the puboretal sling, and it will allow the forward rotation of the head. Okay, and thus help in the parturition. Then during parturition, because of this pressure by the fetal head, there is a chance that there is always a tendency for perineal tears. Okay, according to the extent of the injury, we can classify it into first degree, second degree, third degree, and fourth degree perineal tears and all. So again, you will be studying all those things in the clinics. Okay. So in order to avoid the perineal tears, you can give perineal support. Okay, and also you can do an episiotomy. Normally we will be doing a mediolateral episiotomy, especially on the right side. Okay, so that we can avoid further perineal tear. Okay, so as to avoid the perineal tear. So that's all about the pelvic diaphragm. Hope you have understood it. Thank you and have a nice day.